Welcome to another installment of our webinar series. So today, RSNA and the 3D printing SIG are pleased to present a presentation called the RSNA-ACR 3D Printing Registry, Case Examples, and Data Entry. Just very briefly, I'm Ken Wang. I'll be moderating today's session. I'm an MSK radiologist at the VA hospital in Baltimore. I'm an adjunct faculty member at the University of Maryland, and I also serve as the liaison from the RSNA Informatics Department to the 3D Printing Special Interest Group. Okay, so as many of you know, RSNA is a global organization with many thousands of members from all over the globe. The 3D Printing Special Interest Group was founded in 2016 by Dr. Frank Rebecki. The mission of the SIG is really to promote high-quality clinical 3D printing through education, collaboration, and research. Over these last several years, the SIG has been active in many areas. We've had publications on the clinical appropriateness of 3D printing. We've had a running interaction with the Food and Drug Administration around regulatory issues in 3D printing. The registry represents a collaboration between RSNA and ACR to support the practice of 3D printing. And other active areas for the SIG include quality assurance and education. For those of you who may not already be members of the SIG, if you're interested in becoming a member, please take a look at this link at the bottom of this slide. All right, so again, today's webinar, the 3D Printing Registry Case Examples and Data Entry. This is a follow-up to a previous session that we held early in June. During that webinar, which you can also find online, we talked about the registration process for the registry and also about the data dictionary, which defines the data fields that the registry collects. So since that time of the previous webinar, the registry has gone live for case submission. And today we're going to hear more about how to take real 3D printing cases and enter them into the registry using the case report form that you'll find on the NRDR site. NRDR is the platform of the ACR for imaging registries. We'll have some time at the end today for questions and answers as usual. However, today we're also going to encourage people to type in questions as we go. If you have specific questions about what you're seeing on the screen as it relates to a particular case or a particular usage of the case report form, we'd encourage you to type those questions in as we go. Also going to take a moment to once again acknowledge our vendor supporters of the registry project. These four vendors, Formlabs, HP, Materialize, and Stratasys, are supporters of the registry project, and really this support has been critical for the registry. With that, I'd like to take a moment to introduce today's speakers. Many of you know both of these speakers. I'm really glad they're both here to present to us today. So Amy Alexander is the Senior Biomedical Engineer in the Mayo Clinic Department of Radiology Anatomic Modeling Lab. She works on anatomic models and surgical guides for bony reconstruction surgery. She chairs the Engineering Education Subcommittee of the RSNA 3D Printing SIG, and she's a member of the ASME Medical Additive Manufacturing Advisor Committee. She also chairs the SME Medical Advisors Committee, and she's an active journal reviewer. Amy holds a Bachelor of Science in Biomedical Engineering and a Master of Science in Engineering Management from the Milwaukee School of Engineering. He holds additional certifications in additive manufacturing from MIT and SME. And in 2019, Amy was recognized as one of 14 international recipients of the SME Outstanding Young Manufacturing Engineer Award. Dr. Nicole Wake is an assistant professor of radiology at the Albert Einstein College of Medicine, and she's also the director of the 3D Imaging Lab at Montefiore Medical Center in New York. She is also an adjunct instructor of radiology at NYU Langone Health, where she received her PhD in biomedical imaging. Her research is focused on creating 3D models from radiological imaging data and quantifying their added value in patient care. This year, Dr. Wake is the treasurer of the RSNA 3D Printing SIG, and she serves on the ACR RSNA Registry Data Governance Oversight Subcommittee. Many of you have had the pleasure of hearing both Amy and Nicole speak before about their work. Those of you who have, you know that they're both really great speakers who do outstanding work. So thank you both to Amy and Nicole for speaking with us today. And with that, I'll turn it over to you, Amy.
Thank you very much, Ken. Nicole, go ahead and share your screen with the slides that we've prepared. Well, good morning or good afternoon, everyone. Thank you for taking the time to join us today. We have 3 cases prepared to show a simple anatomic model, a more complex anatomic model, and a fairly simple anatomic guide. And as soon as Nicole gets those slides up, we can start reviewing the first model, which is a 3D printed spine model. So this model is a spine. The patient was a 74-year-old male with severe cervical thoracic deformity, and the model was to help in the correction of that deformity. This model was printed on a Stratasys Objet 500 Connex 3 printer, mostly because of the build volume size of that printer. We cannot fit a full-size adult spine on many printers that we have here at Mayo, so the object gets used for those that are larger and full size. We printed this model in a Vero White Plus material and a 706 support. The time for printing was 32 hours, 26 minutes, and we used 1,200-ish grams of Vero White Plus and 700 grams of support 706. All right, Nicole, we can go to the next case. So this was a left renal tumor and cyst case where the surgeon was planning robotic-assisted partial nephrectomy. This was part of a renal sparing study that's being done at Mayo currently. So the surgeon wants to use the model to understand what parts of the parenchyma are being invaded by cyst and tumor, and what geometric relationships exist between tumor and important structures like the collecting system, vein, and artery. So the difference between the first simple model of the spine and this model is that there are more anatomic parts that were segmented to create the model. Here we also use the Stratasys Objet 500 Connex 3 as is dictated by the research protocol, with the palette of Vero Yellow, Vero Cyan, and Vero Magenta, and support 706. The print time was 8 hours and 39 minutes, with 200 grams of Vero Yellow and Vero Magenta, and around 100 grams of Vero Cyan going into this model. We can go to the next case. This is a central pin placement guide for a reverse shoulder arthroplasty for a 68-year-old female. So one of the most difficult parts of the arthroplasty procedure is placing this central pin, and this guide fairly simply allows the surgeon to plan the pin placement and then build a guide to help complete that placement and that trajectory in the operating room. This guide was printed on a Formlabs Form 2 printer in Dental SG material, 75.5 milliliters, 4 hours and 2 minutes, and we will consider this our simple guide example. I believe now we can transfer over, put these over to the side, and pull up the new NRDR RSNA-ACR 3D Printing Registry.
Nice. Hi, everyone, and thanks for having me today. Montefiore was one of the first sites to join the ACR RSNA registry, and when it opened for case submissions a couple weeks ago, I was the first to enter some of our printing cases. Now the University of Cincinnati has entered some cases led by Frank Rubicki, and we hope that more institutions will start becoming members of the registry and entering cases. Currently, we're accepting cases from 2020. And so you can see the NRDR Near Dear portal here. So this is what you'll see when you sign onto the main site. You can go back to the ACR NRDR homepage. You can click on Learn About 3D Printing and see more about the registry and overview. And again, thanks to all our vendor sponsors and contributors to helping us fund this registry. And then we can go to data collection here. Underneath, we can see register a new case or search cases. We also have the 3D printing data dictionary that you can download to see what the information is that we're looking for. So here I'm going to go ahead and register a new case to do this simple anatomic model example. So once you click register new case, this 3D printing case submission form comes up and it shows you in progress. It has information about your facility. Each institution has to give a non-identifiable case identifier number. So each institution is responsible for that. I'm just going to make up a number here. But it's important to record these and make sure that you can track it back to your own patients here. Then we have to enter the sex for the patient, so male or female, and then for pediatric, less than 36 weeks gestation, yes, no, unknown, or not applicable, and that's important for some congenital heart disease models specifically. Next, we give information about the imaging that was performed in order to create these models. So once we click imaging description and indications, we have the opportunity to add the imaging exam. So we can enter the patient's age, whether or not it's known, unknown. I'm going to just guess here because I don't remember the age of Amy's patient. And then we did a CT for the bones, and we did the spine here. Here we have a full spine, so we have to enter multiple portions, and then we click add anatomy and it populates into this field here. So again, I'm just going to enter multiple parts of the spine so that they all populate. And then you can also enter agnostic structures such as arteries, veins, collecting vessels, bones, nerves, etc. if you want to. We have information about the contrast, so intravenous contrast or oral contrast, with or without. I'm going to select without here. And then to save this, you just click the save button here. And then we need to add next the 3D printing indication. And we can have up to 5 indications. So here I'm going to select MSK. We have all these different systems, so neuro, cardiac, chest, GI, etc. So here MSK, and then there's different types of fractures, ligamentous injuries. Here I'm going to select scoliosis as my primary diagnosis indication, and then click save. And so once that's complete, we're ready for the digital model. So did we make an anatomic model or an anatomic guide? So here is our model. And then what did we use it for? Was it planning, simulation, templating, collaboration, or others? So this was for planning. Next, we add our ordering service. So click ordering, and was it a medical or a surgical specialty? So if you select medical, these are your options: cardiology, endocrinology, gastroenterology, infectious disease, internal medicine, etc. Here I'm going to select surgical specialty, and then here are our options. I'm again going to select MSK orthopedic surgery here. Select save. And then we collect information about what we use for the segmentation and CAD modeling. And so here are our options. So we have a list of different types of popular softwares that are used, and then you can also select something else if none of something used isn't included. Here we use Mimics, and so I'll add that. You can also add more than one. So just as an example, let's say I also used the GEAW. I could add that one as well. So you could have multiple. And then CAD modeling, similar principles. So we use 3matic here, but you can select something different or multiple again. And then once you're done with that, we're ready to add our anatomic part. And so here we select the region. So spine again is our region, subregion, the portion of the spine. So cervical. And again, I'm going to add multiple parts since this was a huge model. here. And you can add region agnostic structures. So let's say I printed some arteries or nerves along with the spine. I could add those up there as well. And then you can add comments. So maybe here I want to say like small portions of ribs included. You can type a comment. And then just click save. Oh, I have to select the region agnostic structure, so I forgot to select the bone here. So bone is my region agnostic structure. If you have like an extremity, you could have a laterality. Here we have the spine, so it's not applicable. And then click save, and you can see your anatomy here. Now I'm ready for my physical model, so I'll add my physical model. And then I can click in this box and see the digital model obviously should be translated into the physical model, so it populates automatically. And then we can select the printer information. And so here actually, I only have these two printers listed. If we wanted to add another printer, I can click Manage Printers, and all of these printers come up. I can add a new printer, and you can select I can call it like printer 1 or whatever you want to call it if you have a name. You can select the manufacturer. So Stratus is here. And then I can select the model here. So object, Connex 3, object 500. And then the technology should hopefully automatically populate. You'll have to select where you are, what facility you're at. So here I'm going to select this one and click save, and it will populate. Go back to my data entry. We'll see if it's not coming up, so I'm just going to select another one instead here. Let's pretend I'm selecting the Stratus. I'm going to have to select different materials, but you guys get the point here. So it fills in the model I selected, the material extrusion, print model scale. This is a scale of 0 to 1, so we printed in a 1-to-1 scale. For this, Amy says she used Vero White, but because I have the wrong printer populated, I'm not going to be able to select that. So I'm just going to select something else. We have a spot for the amount of materials, the amount of grams. So you just manually enter that. Grams or milliliters. Was the support material different from the primary material? Yes or no? So here, there was support material different. It was another material because it was another printer. We can manually list it, but it could auto-populate for you. The amount used was 658. So just enter that there. And then information about material properties. Was it transparent, semi-transparent, opaque, unknown? Was it stiff, medium, rigid, or soft, medium, or rigid, or unknown? So here, rigid. Did we do a multicolor model? No. Limited palette, full color, or unknown. And then just a few more questions about the material. Multi-material. Was it metal? Is it biocompatible? Yes or no? And does it need to be sterilized? And then print times. So this one took a long time, 32 hours, 26 minutes. And did you print more than one copy? No, we only printed one here. So then go ahead and click save, and it will save everything. And then next is some information about the procedure, the use of the 3D printed model, and you can select up to 5 procedure types. So here, surgical procedures on the MSK system is what I'm going to select. And then again, it asks you for the age of the patients. And we believe this is important because we don't want to create the model several years before using it, obviously, because things could change. So hopefully the age at time of imaging will be consistent with this age reported here. I'm just going to guess the age again. And then we have information here about the effort, the clinician effort, the consultation effort, segmentation effort, CAD time, prep post-processing time, and then the same efforts for non-clinicians. And here you have to enter hours and minutes for each one. And if you don't enter something in here, an error message will come up at the end. So it's important, even if it's 0, to put a 0 in these boxes. So I'm just entering random numbers here just to show you guys the principle. And then we also have next a user assessment of the model. So if the person that used the model gave you feedback on it, these are the questions that we're asking. So was it an attending or a trainee? And then information about the service, medical specialty, surgical specialty, similar to what we had above. Same categories here. and then questions about the 3D model and what impact it had. So the 3D printed model or guide was easy to use, and it's all on a 1 to 5 Likert scale. So strongly disagree being 1, and then strongly agree being 5. And then before using the 3D printed model, I was confident. After I was confident, as a result of the 3D printed model, the treatment plan was altered or refined. Use of the 3D printed model was important. The quality of the 3D printed model or guide was adequate. Use of the 3D printed model or guide was compatible with other aspects of my approach, and then use of the model or guide was saved me time. And then you can have actual minutes written here, and then a little question box where they can type in free text. And so this is primarily for the users of the model, the surgeons, our clinicians. And it's possible, if you save everything without this, to come back and enter this at a later time. So I'm going to go ahead and skip this for now. Click Save. And then the outcome, we have outcome information. So operative procedural time, fluoroscopy time, blood loss, surgical margin status. So again, if you have this information after doing the case entry at the beginning, you can enter it, and then name of the person responsible. You can add new people here, and then you can either save the case or submit the case to be finalized. So I'm not going to submit just now, but I'll Ken, do we have any questions, or should I go on to the next case?
Yeah, let's keep going.
Okay, so next case is the renal model example. And so I'm going to just register new case and start from scratch again. And here we have the multi-part model. So again, I have to enter my case identifier number. I'm going to make something up, but it's important to make sure you can match that to the actual patients. Select information about the patient, not applicable for pediatric gestation information, so add imaging exams, and you can add up to 5 exams. Again, patient age, modality, and here we have CT, MRI, nuclear medicine, surface scanning, ultrasound, rotational angiography, or other. So I'm going to select CT. Again, here abdomen for the anatomy, and then the structure, kidney, with or without contrast. So we do with contrast here, add anatomy, and then let's say I wanted to use the CT and the MRI, I could also select an MRI, I believe. So I could add another one with the MRI if I want to co-register one to the other. All right, so now go to the digital model. Oh, I forgot the indication. So here, indication, GU, and then renal cancer or renal cyst, etc. So we've pre-populated what we think are the most common indications. If there's something missing, you can check other and then write in your indication there. So again, an anatomic model, purpose for planning, and then information about the ordering service. So again, we have a surgical specialty, and here we have GU, urology. Save here. And then I'll go ahead and do the segmentation software again, Mimics Innovation Suite, and then 3matic. Add software. Again, you can add more if you have more, and then we'll go ahead and add the anatomic parts. Okay, so I'll select my region, abdomen, the structure, kidney, and then we have, I'll add that laterality. We have to select a laterality, so I'm going to select right side here and click Save. I'm going to try to add another anatomic part because we have the cyst and the tumor, and then the artery, vein, and collecting system. So here, instead of selecting structure here, I can go under the region agnostic structure and select tumor, and then add anatomy. And then again, I can select artery, add anatomy, or save, and then I have to do it over again. Add anatomy, and then save. And it said it's already been added, so this time I'll do the vein. Okay, so abdomen, kidney, abdomen, artery, abdomen, vein. I can keep going. Abdomen, and then tumor. And then I have my cyst. Let's see if that comes up. I'm going to select other and region agnostic structure here. And I have one more, the collecting system, I could add to make sure we have our complete model. Laterality, right-sided laterality. So now I have my 1, 2, 3, 4, 5, 6 part model corresponding to this model here. So the kidney, the artery, the vein, the tumor, the cyst, and then the collecting system ureter. So now I'm ready to go to my physical model, and we can add up to 5 parts. So basically when I click on the anatomic parts, all the parts that I created above come up, and I can select those. So I'm going to place them in here. And then again, printer 1 was that printer that I just labeled. So hopefully, yep, Stratus Connex 3, object 500, material jetting, model scale. I'm going to put 1 for 1:1. Primary material was rigid. And then the amount of material for this renal tumor model was 258 grams yellow, 96 cyan, and 217 grams. So I'm just going to estimate that was approximately 500, but I would do the exact calculation for real if I was going to formally use this for the data entry. And then, was the support material different from the primary material? Yes or no? Yes. And then I would enter the information about the support material, wax material that was dissolvable, and then the amount used. Again, optical considerations, transparent, semi-transparent, opaque, and then information about the stiffness, multicolor. This was a limited discrete palette with 5 to 6 different colors. Multi-material, no. Metal, no. Biocompatible, no. Sterilizable, no. Print time, 8 hours and 39 minutes. And we did, again, 1 copy. So I'd save all that information. And then again, put the procedure type in. We can select surgical procedure of the urinary system, and then age of the procedure. Save this, and then information again about the effort. I'm going to skip over this. User assessment, outcome, person responsible for the data collection, etc. So very similar to the case above, just a little, takes a little longer because we have more structures as shown here. So I'm going to go back to register the third case. This time I'm going to just leave this page. And the third case was the anatomic guide example shown here of the shoulder with the cutting guide. So again, put the case number here, male or female, and then the age, gestation age, not applicable. Information about the imaging exams and the indication. So here I could upper extremity, and then I could do shoulder. Age is a required field. And again, indication here for MSK, and then I would do arthritis here. And then it was the primary diagnosis, and then information about the digital model. So here's where you differ from the previous cases. Instead of being the anatomic model, we have the anatomic guide. And then type of guide, we have cutting guides, positioning guides, contour guides, hardware guides, trajectory guides, or other. So this was a pin placement. So I'm going to say positioning guide of the pin, and was the underlying anatomy used to create the guide also printed in anatomy? And you can see they did print that one, so I can say yes. And then information about the service again, surgical specialty, and then orthopedic surgery. Information about the segmentation software, so all these different types again, we use the Innovation Suite and 3matic, although you can enter all of these or other if necessary, even more than one. So again, we do our anatomic parts. So we enter our guide parts here. Here, because it was a guide that went on the scapula, I'm going to select scapula. And then we have the laterality, so right, left, bilateral, etc. If you want to do free typing, so guide used for pin placement, you can do that, or write any other notes that you want and save that here. And then physical model, add the physical model, and then that part should show up. So scapular, right, guide used for pin placement, information about the model. So this one was actually printed on the form too, but I don't have that one here. You could add that obviously by manage printers here, just in the interest of time, and use the form 3 because it's very similar. It'll auto-populate the technology type and printer type for you. Manufacturer, print model scale, again, we use a 1-to-1 scale, and then it will give you the resin materials here. Here we used surgical grade resin, so I'm going to click other and put the dental SG, which was the primary material, and that's important for here because it was biocompatible and sterilizable. Again, the amount of material here, since Formlabs is a resin printer, we have milliliters, not grams, and then the support material is the same. So no here. Somewhat transparent, unknown, opaque. You can select whichever one you hear, rigid, medium, soft, and then multicolor, no, yes, etc. So no, and then here is where you can select information about the sterilizable and biocompatibility, which is important, obviously, when we're bringing the model to use in the sterile OR field. Print time here, so 4 hours and 2 minutes. And again, we did 1 copy. And then I could save that information. And then we have information about the procedure type. So procedure on the MSK system, AJET procedure. Save this information. And then next would come the effort. So we could fill these in about the clinician effort and then the non-clinician effort. Again, user assessment, which we can give to our surgeon to answer those 5-point Likert scale questions. And then outcomes, so operative times, fluoroscopy times, blood loss, etc. And then information about the data collection. So I hope this gives you a good sense of what we're looking for in the registry and how you can put both anatomic models and guides into the registry data collection form. And we understand that this manual data entry is somewhat tedious, and we're currently working on some more automated solutions through TXT files, REDCap, and EPIC. So stay tuned for more information on these.
Great, Amy and Nicole, thank you so much for taking us through those cases. I think it's helpful to kind of see a real case and how that maps onto this case report form. We have gotten a couple of questions through the chat box, so let me go ahead and answer those. One question was, do participants need to be SIG members in order to participate in this registry? The answer to that is no. So the registry is supported by RSNA and ACR, but there is not a requirement for SIG membership to enroll in the registry. All that's required is that institutions enroll through the NRDR institutional registration page. So thanks for that question. Another question was regarding the case identifier number. Nicole, if you can just scroll back to the top of the form to show where that field is located. And that was that first number field that Nicole populated for each of these cases. The question here is it possible for different facilities to have their case numbers collide with each other? And that is not a concern. Really, the requirement is that this institutional case identifier be unique within that institution. So among the cases that your facility is entering, this number should be unique and should, can be tracked. The idea is that you can use this number to track back to that case within your own records. But between facilities, these case identifier numbers don't collide because the facility has its own unique identifier. You see that on the left-hand side of Nicole's window there. The NRDR facility ID serves to kind of prevent collisions between those case identifiers. So thanks for that question as well. And in terms of that case identifier field, as I've said before, one simplistic approach, which I think would work well, would simply be for facilities to just keep a running count of the 3D printing cases they've submitted and to just kind of increment that counter for each subsequent case. And that would be one way to approach that. I do want to encourage others to enter any other questions that you may have into the either the Q&A box or the chat box in the WebEx interface. In the meantime, I thought we could kind of highlight a few points that kind of showed themselves while Nicole was going through these case submissions. One of those, which I think is something we've talked about in the past, but I think is still potentially a source for confusion for folks, is the difference between an anatomic model and an anatomic guide. That's a question that I think different people would have different answers for. For the purposes of the registry, we've really kind of distinguished those things based on what's represented in the object, not on how the object is used. Again, I've said this before, I don't mean to be repetitive, but again, I think it is a point of potential confusion. There is some text in the data dictionary addressing that, so feel free to take a look at that. But again, the kind of the fundamental principle that we've put forth for the purposes of the registry is that anatomic models are primarily defined by the fact that they represent anatomic things, whereas anatomic guides are not defined by the anatomic features, but defined by their kind of more engineered features. Let me pause there. Amy, Nicole, do you guys have any follow-up comments you'd like to make?
No, I think it's really exciting that we have the registry open for data entry, and that it's important that as many sites register as possible and start entering these cases so that we can start using this data to gain evidence towards the Category I CPT codes.
Agreed. All right, here are some other notes that I made to myself as we were going, which again, I think are potentially questions that could come up. One, and sorry, I know you've put up the Q&A slide here, but Nicole, I wonder if you could go back to the case report form.
Yeah.
And in the imaging description, which you have here, and you kind of took us through how to use the anatomy for the imaging description. What you showed us is that the way that the registry talks about the anatomy for imaging exams, which is what you're showing here, which is the region, the subregion, the structure, the region agnostic structure, those drop-down menus. We saw those same menus later on again when we were talking about the digital model, which is kind of like the segmented anatomic parts. So it's the same system of fields, in the digital model, where we talk about region, subregion, structure, region agnostic structure. But I want to just highlight that the way that those different sections use those fields is a little different. When we're talking about the imaging exam, we're really just talking about kind of the level of what scan was ordered and performed for that particular imaging study. So that's like CT of the abdomen and pelvis, or it's like an MRI of the brain. Whereas when we're talking about the anatomic parts, we're really talking about more detailed information. It's not just that we did a model of the abdomen, it's that we were talking about the collecting system. So the level of anatomic detail is just a little bit greater when talking about anatomic parts than it is when we're talking about imaging exams. Just useful to kind of keep that distinction in mind.
Thanks, Ken. That's really helpful.
Okay. And here's another point that I think might be worth just talking through a little bit further. And Nicole, I'm glad you were able to kind of show us on the fly the Manage Printers link. But if we could go back to that. here in the physical model portion of the form, where we click that Manage Printers link, I just want to emphasize one more time that each facility has in its Manage Printers table, like Nicole is showing us right here, has kind of a library of those machines that it is operating. And so we expect that this list would only change infrequently. So you install a new printer, you'll add a row onto this list, or if you decommission an old printer, you might turn it into an inactive printer. But that this table would change slowly and only occasionally. And when you need to, you can access this Manage Printers interface. But that typically, when you're entering the specific details for a particular case, that you're just referencing this list through the name that you've assigned in that label column. So the very left-hand column in that table that says label, you saw how Nicole was referencing these printers through that label. So again, just the idea that you're referencing this table, but not really editing this table frequently.
Yeah, and one more thing to point out about the table and entering printers is that the number that you have for the printer, like here, 107592, has to match the number that you're signed in on. So for example, the ones that weren't showing up here, I accidentally had added them under the 100530 number. So when I was trying to populate the data, they didn't pop up because the numbers weren't matching. So we have to make sure that those match, and then those can be changed at the bottom here. So the facilities, you can add like one or multiple facilities depending on how many your institution has.
Right, that's an important wrinkle that we haven't talked about a whole lot, so thanks for mentioning that. But the idea is that facilities may have multiple sites. Those sites show up as these different facility IDs. Printers are associated with specific facility sites. Okay, we do still have about 15 minutes allotted for this WebEx. If there are other questions, I would encourage folks to, again, make use of the chat box or the Q&A box. Some other points to highlight about the form, I think, relate to the fact that some fields are optional. As Nicole said, we recognize that the completion of the case report form is time consuming, and there's a lot of information that is being requested on this form. However, many of these fields are not required. One good example of that is the user assessment, I think. So the user assessment is the series of Likert questions. And while this is very valuable information to have, feedback from clinical end users about 3D printed models or guides, we recognize that in the clinical workflow of things that it will often be difficult to obtain this kind of information. So I don't want people to go away from this thinking that, oh, if I can't get those Likert responses, then I can't submit the case. That's not the case. This assessment portion is optional. If you have it, great. If you don't have it, that's not an obstacle to submitting a case.
And you can see if they are required fields, they do have the stars next to them. So you can immediately recognize what is required and what is not required.
Okay, and I think I am now seeing some additional questions on the Q&A. Let me try and get through these. Okay, here's a question that reads, can you go into greater detail around clinician consultation with some examples? Do you count reviewing with the patient? I presume this is separate from segmentation Q&A. That's a very good question, and I think this relates to this effort panel that you have expanded right here, Nicole. So the question is about the very first line there, clinician consultation. What does that really include? And really, we intend that to be kind of a broadly defined field that is inclusive of many different things. Should it include reviewing a model with patients directly? That's a good question that I don't have a definitive answer for off the top of my head. I will say, though, that to answer the second part of this question, that this is separate from segmentation. So if a clinician, like a radiologist, is involved in model construction, then if that radiologist, as an example, performs a Q&A operation and reviewing a segmentation, that's not consultation, but that would be in the clinician segmentation effort. Again, time spent directly reviewing with patients is something that I think we would need to discuss and open to thoughts that people might have about that.
Yeah,
Yep, go ahead.
Sorry, Ken. When we were coming up with the design for the registry, the consultation effort was sort of the effort for whoever made the model and printed the model, like explaining the model to whoever was going to use the model, not how the clinician was going to use it with his patient. But maybe that's something that we could add in to show the importance of the utilization of models.
Yeah, I think that's a fair answer. I think that's fair. Here's another question. It's a question about generating reports from submitted cases. The questioner is indicating that they're trying not to duplicate work if it's not necessary for their own internal tracking. That's a good question. And I think the question, again, to just kind of rephrase it, is after the effort of entering cases into the registry site, can participants then kind of make use of that information and pull it back out for their own internal purposes? I think the answer to that should be yes. But the degree to which that is possible right now, I'm not sure of. As another part of an answer to that, one thing that participants will receive once the registry has been in operation for a while is periodic summary reporting from the registry, which will include summary reporting of that particular site's cases submitted during a period of time. So if you're looking for summary information about numbers of cases over a period of time or types of cases, then that summary information would kind of come back to you as a participant automatically, periodically.
Yeah, and can I just add one thing to that? Sorry, Ken. We're trying to design like templates for like dictation templates for Epic and things that would go the reverse way so that you wouldn't have to do the manual entry. So maybe there's a way to tie in both of those.
Right, and that actually segues to the next question, which is about batch uploading of the data fields. This questioner is asking about using a CSV or an Excel file to upload data. And that kind of speaks to the automated mechanism that you were just mentioning, Nicole. So our plan is to develop a mechanism for electronic submission of case data so that you can automatically assemble these data fields, say, from your reporting templates, and then assemble those in, say, a CSV file, which can then be electronically submitted to the portal without having to go through the case submission form. That electronic mechanism is pending right now, but it is something that we're actively discussing. There's another question about the webinar being recorded. We are recording this session, and it will be available for viewing offline. And Dr. Rubicki is indicating that time spent consulting with patients is something that we should include in consultation time. And I think that's valid. So I think that there probably needs to be a little bit more formalism around the definition for that field. I take that as useful feedback. And so we'll work on incorporating some more formal description of that. We do have some other questions here. All right, here's a question. For a complex model, is it necessary to add all the anatomical parts, or are the important ones sufficient? That's a good question. And I think the answer to that is really that we're looking to capture kind of the entirety of the work that went into creating a model. That would say that for complex models, the registry is really interested in getting a complete picture of all the parts that were created. And so really we would want to know about all the parts in a complex model. There's another question about the sufficiency of a case report that would be kind of sufficient for submission. That's a good question. And the answer to that is that the degree to which fields are required or optional is built into the case report form. If required fields are not specified, then the form will come back and indicate that the report is not yet complete enough for submission. So you get error messages back about insufficiently specified cases. Okay, we have two more questions about effort. And one question is that depending on the experience of an operator, that the effort times may be very different for people who are less experienced and versus more experienced. I think that that's true. And there's going to be a lot of heterogeneity in that regard with regard to the effort that was spent. At the end of the day, I think one perspective is that, well, the registry is interested in knowing how much work was required to create a particular case. And if a particular case done by particular individuals required a certain amount of time, then really that's what these fields are intended to collect. And if practitioners were more experienced or less experienced in a particular case, these fields don't address that question, but ultimately the presumption is that those individuals who are involved in making the case were qualified to do so, and that these effort fields just summarize the amount of time that was spent. It's a good question. I think, again, potentially a lot of heterogeneity there. Another question is asking for more clarity around these effort categories. And this is a long list. What I would say is that there are two different axes that are used to organize this list. That sounds like a funny way to describe this, but there are two categories, say the first four versus the second four, and those are distinguished by the category clinician versus non-clinician. The important difference here is that we're using a definition that comes from the AMA and CMS regarding billing. And clinician is a term we're using here similar to another term that's often used in the billing world, which is qualified healthcare professional. And those are various roles, clinical roles that are eligible for independent billing. And so when we're asking about clinician consultation, segmentation, CAD, and prep and post-processing, we're really referring to those individuals that fall under that qualified healthcare professional definition versus non-clinicians who are other individuals who may be involved in a case, such as technologists, research scientists, and other individuals like that, engineers. So that's one organizing category for these fields. And then the other axis is the type of effort. And so those four types are consultation, segmentation, CAD, and prep post-processing. There are some descriptions of what those fields refer to in the data dictionary. Broadly speaking, consultation is time spent working with requesters or patients. Now, based on today's discussion, segmentation, time spent deriving a surface model from images. CAD time additional time or separate time spent creating engineered features. And then prep and post-processing time, that is time spent working with the 3D printer itself, preparing your surface model for submission to the printer, and then time spent cleaning the model after it comes off the printer, curing it, things of that sort. So that's a good question. And thank you for asking that question. I think there is potential for some confusion there. Again, refer to the data dictionary as Nicole is showing here. Okay, well, I think we've addressed the questions that I have seen. We're also coming to the top of the hour. I'd like to thank our speakers again, Amy and Nicole, for walking us through these clinical cases and showing us the use of the case report form. And with that, I'd like to thank all of our participants for joining us today. And stay tuned for further installments in the SIG webinar series. Thanks again, everyone.